I just want to ask you about the guest you had on last week, who was the doctor who didn't accept health insurance. And I was just
Yep.
wondering if you could talk briefly about how, even before we had Obamacare, how the government interfered with the healthcare system that we had. I just know that people often argue that we had a free market system before that and that it didn't work. And I was just wondering if you could talk to that.
Not even close. Not even close. In fact, my dad tells me the stories about how he helped his mother when Medicare, was first introduced, because now she had a lot of complicated forms that she had to fill out, and my grandmother, she never worked outside the home. She raised 8 kids. She was a stay-at-home mom, and when her father, so she was trying to figure out Medicare when it first came out, and so my dad was helping her. But he noticed right away that the doctor began charging her much more money for the same services that he had before. And my dad even talked to the doctor and said, look, why are you raising your prices? And the answer was, well, look, what do you care? It's getting covered, by the government. So I'm not really raising my prices to your mother. I'm just raising the prices. The government's going to pay it. So it started right then. And, my dad tells me when he got started in the insurance industry, he used to sell a major medical policy, which was his best-selling policy. And it cost $5 a month. That was how much the insurance cost. This was in the early 1960s. It was $5 a month. And that was it. And that's all your health care cost you. $5 a month, and you were covered for catastrophic care. Meanwhile, your routine procedures were very inexpensive. Nobody really worried about medical bills because they weren't high. And this was the healthcare system we had before the government screwed it up. The minute the government came in and tried to buy votes by giving us healthcare for free, the cost of healthcare skyrocketed. And now we have a crisis. But the problem with the Obama administration, and one of many, is rather than recognizing the role of government in causing the health crisis, in causing prices to skyrocket, which is what always happens when the government gets in the way and subsidizes something, is prices go through the roof. Instead of recognizing that what we need is the free market, instead of looking at how well the free market has worked in the computer industry or the cell phone industry or the consumer electronic industry and in general, because you could say, why aren't television prices going up? Why aren't camera prices going up? After all, they're better. They have more features. That's why they tell us that healthcare is more expensive. They say, well, it's better healthcare. We have more stuff now. It's more sophisticated. It does more stuff. We can treat more things. That's the same thing. If the government was controlling the computer industry, that's what they would be saying. Why are computer prices so much higher now than they used to be? Well, because they're more powerful. We have more computing service. They do more stuff. That's why they cost more. Of course, we really wouldn't have much advancement if the government was controlling it. But that's what they would be saying. But the fact of the matter is, the free market is what controls costs. It brings costs down because everybody wants lower costs. The customer wants lower costs because he wants to buy stuff. The sellers want lower costs because they want to sell more stuff. And they know they can have more customers. Why does Walmart want to keep their prices down? Because they want more customers. They know they can sell more stuff if the prices are low. So in a free market, everybody wants low prices. Everybody's trying to figure out how to cut costs to bring prices down. The government, gets in the way of that and obscures those free market incentives, and now people want higher costs. My grandmother didn't care that the costs were going up. She still consumed the services because the costs were being put on the government. The doctor didn't care that he was able to charge my grandmother more because he knew he wasn't going to lose her business because the government was picking up the tab. So instead of President Obama acknowledging how much government has screwed up our healthcare system, he went all in, or not quite all in yet. That's coming when we have total socialized medicine, but he put more government in the pot. He went deeper in, and now we have more government involvement. And what's happened since? Prices for healthcare and insurance prices are rising at an even more rapid pace since we've passed Obamacare than before. And, of course, it hasn't even gone into full effect. So if you think healthcare costs are rising fast now, you ain't seen nothing yet. Wait till 2014. But Lucas, thanks for your patience and calling back. We got one more segment coming up on Open Line Friday. We'll be right back.
The Peter Schiff Show.